Everyone, my name is Dorothy Friesen, and I'm very happy to feel very privileged to give you a little bit of flavor of the Philippine Access Outreach Program. Okay, when I became an Access trainer in 2006, the Philippines was in the back of my mind because many years before that, during martial law in the Philippines, that was many years ago, but my coworkers, my Filipino coworkers, were facing such life and death situations. The intensity of that made us lifetime friends. And it was these long-term friends, many of whom had been arrested, imprisoned, tortured, waterboarded, or had members of their family affected. And so in the last few years, they were asking about the healing promise of the potential of BodyTalk. And so they invited me to come to the Philippines in 2009. So what I'm going to be doing here is just two things: summarizing or actually giving an update on the initial pilot project, and giving a few examples of outreach by Filipino technicians elsewhere outside of that pilot project. So our local partner for the pilot project was the Alliance for Bases Cleanup. And as I told you at the 2009 conference, they organized 4 classes for 86 grassroots leaders in areas affected by toxic wastes left by the former U.S. military bases. ABC chose BodyTalk and Access because it's effective and simple, but also the promise of Earth Talk is in tune with their longer-term goal of comprehensive cleanup in the area. Most class participants were unemployed or underemployed, and so their payment for the class was to use Access on family, friends, and neighbors every week for a minimum of 6 months. The following year, those who'd fulfilled their commitment were publicly presented, finally, with their Access certificates in front of their own communities to add outside validation to their work. At the ceremony, I also did an Access demo with the barangay captain. Barangay is just a subunit of the barrio. He was pleasantly surprised he could touch his toes after Access and wanted me to work on all his bodyguards. The technicians then conducted many clinics for neighbors who are now more receptive. Because there's little health care here and safe drinking water is an issue, technicians face neighbors with everyday problems like infections, pneumonia, allergies, skin disorders, stress about lack of livelihood, as well as cerebral palsy, heart disease, and asbestosis. That's especially among the base workers in ship repair who worked without protective gear. In many cases, Access has relieved egregious symptoms so people can be more functional, but obviously more is needed. In 2010, both Ben Manalo and I gave BodyTalk sessions in the area. Ben also taught the first module 1 and 2 in the Philippines. Yay, Ben! One of the staff, Alan Along, took the course, and now he's offering BodyTalk sessions as needed, and he also is supervising the monthly clinics in 5 area centers, and the center is really just in the houses of former base workers. I want to give you a quick example of BodyTalk and Access working hand in hand. In April of this year, a former base worker with chronic kidney condition experienced stinging pain in his right kidney, shortness of breath, weight loss, inability to walk. After the first BodyTalk, the base worker began to breathe normally. By the second session with Alan, the kidney pain was relieved and he was able to stretch out his legs in the wheelchair. The neighborhood Access technician, Regina Alilin, applied Access weekly after that, and in mid-July, 2 weeks ago, she reported he'd gained weight, was practicing walking. In the meantime, Vice Principal Joy Manigo organized an Access class for her students so they could work with the community technicians, many of whom have not completed elementary school, and they found keeping records a challenge. When Joy was promoted to the District Board of Education, she had the board sponsor an Access class with teacher health aides from 10 different schools. Because the schools can't afford nurses, a health aide's just a full-time teacher designated to take care of student health emergencies. The teachers report success with Access in areas like sports and playground injuries and stress about exams. I'm going to switch to some examples elsewhere in the Philippines. This is Michael Oroso. He uses cortices and fast aid regularly when he teaches self-defense to elementary school girls as part of the government's anti-violence program against women and children. And he writes, I told girls Access could calm them down and heal whatever was bothering them inside. I encouraged them to do this every day for themselves and brothers and sisters. It was amazing how relaxed and better focused the group became. In the South, the coordinator, Chick Ramoso, offers Access at the Paraplegic Hospital weekly. So Philippine organizers do reach out to government programs, but they found the most fruitful connections are with private voluntary organizations, especially the church, since the Philippines is 85% Catholic. So here, Sister Pilar taught cortices to other Good Shepherd sisters, which they use themselves and in their nationwide mission with mothers and babies. She organized an access class for native Filipino healers, and Father Efren, a gifted healer, sees hundreds of people weekly, but he was very taken by the idea that BodyTalk is a healing system that can be taught. He's incorporated cortices for his apprentices and helpers. Here, Myrna Arceo accompanies the priest to the local jail, and then after Mass, she taps out the gathered prisoners. She's also taken Access to the cloistered Carmelite Mother House and reports that some of the retired nuns with Alzheimer's have become more alert. Myrna's co-worker, Susan Espinol, uses Access with the Parish Neighborhood Health Program, and she's also presented at the national level advocating use of Access in all parishes. She convinced the Batangas mayor to sponsor an Access class for city health workers. There are a lot of other inspiring stories, but in summary, I want to say thanks to the organizing groundwork of Mirla Baldonado and room and board and in-country travel support by Marilyn Abizamis. So in a 2-week period, we bootstrapped our way to completing 15 Access classes, 6 different provinces, 250 plus graduates. Now the technicians in far-flung places text each other for support, send around the IBA newsletter on their listserv, and those who can tune in with each other through meditation at 9 p.m. The Filipino Committee's current goal is developing certified practitioners and, of course, Access trainers who can teach in the many languages of the islands. One challenge is the cost of the professional courses, because even the middle-class teachers and nurses earn only $200 a month. The committee is investigating Philippine congressional funding and also the U.S.-based Bayanihan Foundation, Filipinos Abroad, helping Filipinos at home, in order to subsidize further BodyTalk training. So I'm ending with heartfelt thanks to the International BodyTalk Foundation, the IBF, for their ongoing contribution in the form of donated Access manuals. A little seeding goes a long way in the Philippines to support grassroots people as they empower themselves and democratize healthcare, their own healthcare. So thank you to each and every one of you here and all practitioners who have been donating to the IBF. I really trust in the near future Filipino Access technicians and practitioners can afford to be at the conference themselves to share some of their wonderful experiences in person. Thanks.